Today's guest is Dr. Anuja Chandran. 8 years of her clinical life to an often overlooked area of women's healthcare and pain management. Dr. Anuja specializes in treating conditions such as vaginismus, endometriosis, and postpartum pain, issues that affect millions of women but rarely discussed openly and privately. What sets her apart is treating the patient as a whole and not just symptoms. She creates a non judgmental space where her patients can heal both physically and mentally. And she focuses on helping them return to their daily activities that matter the most in their lives. In today's podcast, we talk about women's health, and more so specifically pelvic health, all the issues with leaking bladders, vaginismus, endometriosis, and everything that you need to know to take care of your pelvic health. And her credentials are impressive. She has earned her bachelor's in science and sports movement from Purdue University and completed her doctor of physical therapy from the Columbia University and has spent an exaggerating 5 years at the Stanford University Hospital. And more than her qualifications, it's her compassion and passion for holistic health that makes her practice even more transformative. In today's podcast, we discuss all things about women's health, more so to do with pelvic health. So if you are someone who is suffering from these problems, do listen to the end, and also do give us a like, share, comment, because we see that most of you here are watching us but do not follow us. So go ahead and subscribe us, because this will help me in bringing more and more to you in terms of health, wellness, and well-being, so we can take your health span to the next level. So join us in welcoming today's guest, Dr. Anuja, to the podcast. Hi, Dr. Anuja. Before we dive in, I'm curious, what actually made you pick pelvic health and women's health at a time when nobody was actually even talking about it?
Yeah, so I grew up in the US and I studied in the US. I was practicing in the US, and over there is a lot of conversation about it, right? I started off as a neurophysiotherapist, and one of my mentors and family friends who had actually convinced me and inspired me to be a physiotherapist in the first place is a pelvic health physiotherapist.
Okay.
And so she's of Indian origin. She grew up in a small village in Gujarat and now is practicing, has a beautiful practice in the United States. And so she kept telling me for many years before I even decided to move back to India that you have to get into pelvic health. You have to get, this is really how you're going to help women. Like, there's so much you can do. And I was like, oh my gosh, this is like such a big jump from what I'm already doing. Like, I don't know, it feels really overwhelming. Like, yeah, it's interesting, but I just felt like it was too overwhelming for me. And of course, like, natural curiosity about our own health, right? So I started like learning about myself, looking at evidence, etc. And then when I was moving to India, she said, Anuja, this is the time. Like, nobody in India is talking about pelvic health. You have a great platform. Like, please start doing pelvic health like completely and fully when you go there. So that's what happened. And I started talking about it, and I started talking about it with my social circle initially, and people were like, what is this world that you're talking about? And I always had her support, of course, and other mentors in the US. And so I've just, now it's been 3 years since I moved to India, which is crazy. And I think now more and more people are talking about it. It's becoming a hot topic, but 3 years is a long time.
Yeah, 3 years is a long time. And I also know that you're a graduate from Columbia University and the Stanford University. Can you paint me a picture? And you've also worked at the Stanford University, right, for about 5 years there, right? Can you paint me a picture as to what was that opportunity like? Because for most people, they only see it as a dream that's too far away.
Yeah, so I didn't graduate from Stanford. I worked there for 5 years, like you said. Honestly speaking, I didn't expect to. A lot of the things that have happened in my life have been very unexpected. I always, of course, when I was doing my undergraduate degree in the US, I always planned to further study, get my doctorate in physical therapy. That's the only way you can practice in the US. So that was the next obvious step. And I applied to a lot of schools, but I always had this dream of living in New York. So I applied and I got in, and I got a scholarship. And financially, it actually made the most sense for me to go there. And so it just kind of like ticked all the boxes. And when I went to interview there, I just had a very good feeling, right? So my experience at Columbia, though, was really, I would say, intense. It's not an easy program to be in. It's a lot of, I remember telling my mom in the first year that I I dreamt of living in New York, but I've not seen outside the library walls, you know. But nevertheless, the 3 years there were amazing. And I got a lot of great mentorship that I still have today. And it actually changed my career path because I became a physio thinking that I'll be a pediatric physiotherapist. And from pediatrics, I went into neuroscience and neurology. And while I was at Stanford, I got my neurological clinical certification. And then at Stanford, I was, of course, working on the in the neurology department, and then I started again getting more curious about the female body, and so I started seeing clients outside of the hospital who had, who were postpartum or pregnant, because at the time that's really why people wanted pelvic health physio. Now we're talking about other topics, right? Pain with intercourse, we're talking about even just general tailbone pain, bowel conditions, but prior to that it was really just these two populations that needed it. So that's where I started, and I was really lucky because at Stanford they gave us funding to learn and to study every year. We had a amount of money that we could utilize, so I was able to utilize that money to take courses in the US and really educate myself further. And of course you're surrounded by people who are very passionate about the field, which I think is something that's so important when you're starting your career. And I also think mentorship is very, very important, right? Because who your mentor is definitely changes who you are as a person, as a practitioner. So that happened at Columbia, that happened at Stanford, and I think one of the biggest things was that every person that I met around me was so, compassionate about the person that they were seeing, right? There was a lot of empathy, a lot of just care for that person that they were seeing. And I think that's really made me the practitioner that I am today.
I think as practitioners, that's what most of them miss out.
100%.
It's being compassionate and really understanding what the patient needs.
Yes.
Because just listening to them is like solving at least 50% of their problems.
Yes, I completely agree with you. Completely agree with you.
And I think today we are in such a fast-paced world that we just want to prescribe and move on to the next one. And I think this is so deep that it really heals people. It just doesn't treat people.
Yeah. And even I see this in India especially, right? Even now in America things are changing, but especially in India, because of the population of people and maybe the training, I'm not too sure, but there's a lack of empathy, right? We're kind of patients are just kind of seen as like one other human body, and I think a lot of it is just like trying to save that person's life but not looking at that person's quality of life. And so I think that that's where allied health professionals, your physiotherapists, your occupational therapists, your speech therapist, your psychology based therapist, mental health therapist, these are all people who are focused on improving the quality of life of a patient, right? And I think that's really what matters in terms of a long-term perspective, because you can live till you're 100, but if your quality of life is terrible for those last 20 years, what's the point?
I think it's very rightly said, and that's what I keep telling my patients too, that everybody's going to live, but you want to live a life that you want to live and not actually just be alive.
Exactly.
That's the debate between health span and lifespan, right?
100%. Yeah.
And what we want today is a health span and not a lifespan.
100%.
Because having a lifespan may mean nothing, like you said, right? If you don't have the quality of life.
Yeah. Yeah.
So coming from that, can we get to the basics of what is actually happening in pelvic health and what is pelvic health actually?
Yeah. So when we talk about pelvic health, and I've brought my model here because I think visually it makes a lot of sense. It's easier for somebody to understand what I'm talking about. But when I talk about pelvic health, it's essentially anything to do with the organs that are sitting inside the pelvis, which can include your bladder, your vagina, and your uterus, and your bowel, your rectum, right? And that's for women, right? Of course, men also have a pelvic floor and pelvic floor muscles. And so it's important that we also discuss that men also should care about their pelvic
Yes.
health, right? And there are other organs that they deal with, but also very similar, right? They also have a bladder, they also have a rectum. So, they also have sexual health as part of their pelvic floor. But one thing that's also important when we talk about pelvic health is that it's not just the muscles and the organs that are sitting here, because we also know that your core muscles attach onto your pelvis. We know that your hip muscles attach onto your pelvis. Your back muscles attach onto your pelvis. Your inner thighs attach. Your hamstrings attach, right? So there's so many other muscles, and essentially, there's so many other muscles that are a part of this, that a true pelvic health professional cannot just only focus on this, right? We have to look at the whole body as, and that's really what holistic care looks like, because our diaphragm muscle, which is really important for our breathing, our rib cage, it's so strongly connected to our pelvic floor. And so we have to start looking at all the organs in our body, and especially our brain, what our gut is doing, because all of that affects what's going on down here.
It's brilliant because, like you just put it across, right? Most people think that pelvic health is just Kegels and they're done with it. What do you have to say to people who think that?
If I had like 2 rupees for every time somebody told me that, like, oh, my gynac told me to do Kegels, or my urologist told me to do Kegels, or I've been doing my Kegels, I would not have to work a day in my life. Like, I am so tired of hearing about Kegels. So I would say that 95% of the time, Kegels are not the answer to what you need, right? Because a Kegel is literally just a contraction of these muscles. It's not even a relaxation, it's just the contraction. And most of the time, we're finding in this day and age that our pelvic floor muscles have too much tension in them. Now, if we keep trying to contract, they're not actually going to get stronger, because they're moving like it's a very, very small amount, right? And the other piece of this is that no muscle acts alone. So with a Kegel, you're just focusing on this very, it's not a small muscle, but it's also not a very large muscle, right? But you're really focusing only on this, versus thinking about what your core is doing, what your hips are doing, what your inner thighs are doing. And so that's why it's so important that you're strengthening other parts of your body and you're not just focusing on Kegling.
That's so important, because I think I wouldn't blame the gynecologist or the urologist, because we're not taught in medical school about pelvic health. There isn't even a chapter on pelvic health, right? And I'm sure you're aware of it, because like you had to do a specialization in pelvic floor, right?
Yeah.
But another thing that I want to talk to you about is, what are some of the common things that you're seeing today that people are actually talking about? The big thing that is sexual health.
Yeah.
Is painful intercourse an actual thing, or is it?
Yeah, to me, it's an epidemic in India. That's like the best way I can put it, because there are so many women suffering from pain with intercourse, and it is a very, very real thing. And there are a lot of women who are gaslit for it, right? They say they're told by their physicians that this is your fault, what's wrong with you, why can't you just relax, you need to pleasure your husband. I mean, I hear these horror stories when people come and see me, and they're just totally defeated. They're like, I don't even know if you can help me, but somebody told me, or my gynac sent me to you, and I'm here to find some answer. But it is actually really, it was alarming to me when I moved to India and I started seeing these patients, just how many patients come in. And there are actually a lot of patients who come in to see me for a different issue, like they might have urinary leaking, or they might have some challenges with their bowel movements. And I, of course, go through like the whole gamut of questions and history. And it's very surprising to me how many of them would say, oh yeah, I do have pain with intercourse, but that's normal, right? And so they're not actually coming to see me for that issue. And then I have to educate them and say that, no, actually, this is another issue that you have, and you don't have to live this way. You don't have to suffer that, and you should be able to experience pleasure. It's just as important that you experience pleasure as it is that your partner experiences pleasure.
As women, they kind of see pain as a normal thing. Because number one, we have always been taught to endure pain.
Sure.
We've never been told that pain is abnormal and you need to reach out for help, because our mothers don't talk to us about sexual health.
Yes. Yeah.
We are, even today's day and age, I'm telling you, there are maybe 5 or 10%, that is a huge number actually for India, that parents actually teach their children about sexual health, or they
Yeah.
have these conversations.
Yeah.
So I think women are only learning about this either through pornography or either through a friend, but 99% it is pornography.
And so I don't know about the data on that. What I find when I start talking to the women who come into my clinic is that actually a lot of them have had a conversation when they're getting married. Usually it happens when they're getting
Yeah.
married, about the first night of marriage, right? And what that's going to look like. And it's usually like either the mother is telling them, or aunts, or female family members are discussing this with them, and the conversation is always, it's going to hurt, so just bear with it, right? That's the seed that gets planted in their minds. And of course, like you said, they talk to their friends, if they do talk to their friends, but even that is not as common as I would say it is in the US.
Yeah.
And when they talk to their friends, they say, yeah, it hurt, I just kind of had to deal with it, and eventually it went away, or no, it still hurts, and you just kind of have to like grin and bear it and deal with it.
Yeah.
So a lot of times that because that seed gets planted in their mind, when they go to have intercourse for the first time, they're expecting pain, right? And what do we do when we expect pain? If I tell you I'm going to punch you right now, your body is going to automatically tense up.
Fence up.
Everything's going to shut down because your nervous system is trying to protect itself, right? So automatically the gates, as I call them, the pelvic floor muscles, just close, right? Because the nervous system does not want to let that thing in that's going to hurt them, or they think is going to hurt them. And then when they try to have penetrative intercourse, it hurts.
Yeah.
Right? And then we start this terrible cycle of pain that it just gets, and that's our job, is to help break that cycle of pain. And of course, when it comes to pornography, right? If they do explore pornography, they have or even honestly speaking Bollywood movies,
Yeah.
right? You can even talk about it from that end. There's either this expectation, like I had a client this week just tell me, she's in her 40s, she's not had penetrative intercourse, and she's really trying, she's really focusing on it, working through it. And she's like, every time I saw a Bollywood movie, especially in the 90s, it was all rape scenes when it
Yeah.
came to intercourse, right? Otherwise, we never really saw intercourse. And I didn't even really think about that, but that's actually pretty true.
Yeah.
Or when I heard about intercourse, it's because I read in the news about some rape that had happened, right? So there's always this kind of violent like connotation to intercourse, and that again gets planted in our minds, right? And the culture that we're brought up with. So I think it's really important that what you're seeing on TV or through pornography. And of course, if when they're watching pornography, they have another expectation that, oh my gosh, I have to do it like this, or it has to be like that. And I always tell my clients, pornography is like a Bollywood movie. It's the same thing. You don't expect your life to be a Bollywood movie. Do not expect what's going on with your sex life to be like pornography. It's very, very different, and that's completely fine as well.
Yeah, I think that's an important message to be conveyed, because I think whether be it a male partner or a female partner, they come with certain expectations because that's what they think is real.
Yeah.
And most of them get dissatisfied or disinterested even once they figure out that this is what my partner is and this is what I'm experiencing, right?
I think that more than that, and I don't know as much from the male perspective, to be very honest with you, because I don't see that many male clients. But it's more from a female perspective. There is an expectation, right? That, oh, my husband watches porn or my partner watches porn, and I have to be like that woman in the video.
Yeah.
And what if I can't be like that woman in that video, right? Is my partner going to be okay with that? And when we actually sit, I have partners come in together, and when we actually sit and have an open discussion, or I encourage them to have that discussion with their partners, the partners are like, no, I don't expect that, right? But the woman herself has put so much pressure on herself and so much expectation on herself that it becomes, again, very difficult when it comes to actually having intercourse and experiencing pleasure. If you have so much pressure on yourself, your
Yeah.
nervous system is not going to allow you to enjoy
Yeah,
anything.
that's like such a trivial thing, right? But I don't think nobody even talks about the psychological aspect of it and,
Yeah.
the physical aspect of it.
Yeah. And it's very linked, right? Our nervous system controls everything that we do. And I would say that 100% of my clients who are experiencing pain with intercourse usually have some form of psychological component to this as well. It's not purely physical, it is definitely psychological as well. And that's why I work very closely with mental health therapists, and I encourage so many of my clients to work with mental health therapists, whether they're doing talk therapy, they're doing EMDR, they're doing somatic work, right? I incorporate some somatic work in my practice as well, because it's so important that your nervous system is at peace.
Yeah,
It's so important.
I think that's a huge thing that people should understand, that only when your nervous system is relaxed can you experience pleasure. Am I right in saying that?
Yeah, I would agree with you on that. Yeah. And I would say that there are times when you might be in that more upregulated state, right? Being upregulated is not a bad thing. And for some people, that pain is actually pleasurable, right? So there's no like right answer when it comes to pleasure.
Right.
It's what works for you and what you think is gonna, like what you're enjoying.
Yeah.
And I think that's the other thing, right? I see this in India quite a bit, like keep trying to fit things into a box of like, do it this way and this, or this is how it should be done and this is how it shouldn't be done. And this comes to like, this is from like everything in the medical profession or even
Yeah.
in life, right?
Yeah.
And I think it's so important that it's not, there are no hard and fast rules, even when it comes to intercourse, right? Or sexual pleasure. It does not have to be that you're having penetrative intercourse.
Yeah.
That there's so many of my clients who are like, Anuja, I don't want to have penetrative intercourse. That's not my goal. That's fine. Okay, then my goal is to just help you experience it in whatever ways possible, help you to relax your pelvic floor muscles and enjoy whatever you want to do, right? Whether that's with yourself, whether that's with your partner. So there's no like pattern,
Yeah.
right? Like there's no mold that we have
Yeah.
to fit into.
We need to get rid of these molds and patterns, and it's so important. And I think I'm so happy that you are actually talking about this to your patients and you're actually counseling them, because I think that's what we need today. And what are some of these red flags that you see that people ignore about their pelvic health?
I think that when there is significant, like very often I'll have people come in and they'll basically give me symptoms of a UTI, like really like a lot of burning, frequent urination. And I'll ask them like, have you gotten tested for a UTI? Have you spoken to your gynecologist or, touch base with them? And they'll be like, no, I just kind of like, I didn't know what to do about it. And it's been a couple of days. And so that's one thing that I would say, that definitely if you're ever experiencing any kind of burning, urinary frequency, or pain with urination, like that's a red flag. You need to call your doctor and speak to them immediately. Now, of course, there is a condition called vulvodynia that comes up very frequently after somebody has had chronic UTIs, right? So they might experience the same symptoms of burning and urinary frequency, but they don't actually have a UTI. But of course, it's always cleared, right, before we start addressing that vulvodynia component, and that's what we can address from a pelvic health perspective. But it's really important that you don't ignore the underlying cause of what could be happening from a medical perspective.
Right.
Of course, if you have any kind of foul smell or like colored discharge that's abnormal, that is again a red flag. You definitely want to go make sure that you speak to your gynecologist, because that could be something that's going wrong in the vulva. And then another very common one that I see is that people who have extreme period pain, like pain that is so bad that it completely knocks them out. They cannot do anything, and that could be even for like a day of their period, or it could be even longer. And very often that's a sign of endometriosis. And I see again, time and time again, women coming in, and then we do like a complete endometriosis screening, and then I refer them to an endometriosis specialist, because of course it's out of my scope to address the endometriosis from a medical standpoint. But again, that's another very common symptom that I see that women women don't address. And of course, right, we have some very important nerves coming from the spine and the sacrum that are running through the pelvic floor. So if you have any kind of weakness, numbness, pain that's traveling down the leg, any kind of burning, tingling that is disruptive to you, that's something that you must go see a physician
Right.
about.
And I think these are important conditions that we see so commonly, right?
Yes.
And most people just ignore it as, it's going to go away, it's going to be okay.
Yeah.
That's the usual thing about it when we talk about anything related to sexual health, right? Now, with that, what is something that you see in your patients? Do you see that these patients are embarrassed? Is that why they don't see a physician early enough?
I think there's a combination of things. One is that they don't know who to go to, right? That's one. A lot of people in India have that like one family doctor or one kind of general physician. It's not even their GP actually. It'll
Yeah.
just be like a doctor that their family members have been going to for years, who could have a special, he could be like he or she could be an ENT doctor, they could be, something like very random, but you will take all your medical problems to that one person,
Yeah.
right? And they are not actually qualified to, which is fair enough, right? Not, we can't know everything. So they're not really qualified to guide you on this, yet they still do, or they don't send you to somebody else, right? They
Yeah.
kind of take it upon themselves. And they might not be up to date on the evidence, they might not be up to date on the research. So I think a lot of times they'll end up doing that. Or like you said, if it is a family physician, they're very like embarrassed to talk to them about that, right?
Yeah.
Like they don't want to talk about their sexual health with somebody that might tell their family members or tell people in the
Yeah.
community. And of course there's just so much shame around it, right? Even I had somebody who came in to see me. She had had bowel incontinence for 10 years. 10 years she was just leaking stool every day, wearing pads. I mean, just imagine how much that person is suffering,
Yeah.
right? And she said, I just had so much shame around what was happening with my body that I just did not want to go to anybody, or I didn't know who to go to. She was from like a more rural area in India. And I think that just made me so sad,
Yeah.
that they
It
just
is.
don't know that this is not how life should be for them.
Yeah, it is really sad because I think, like you said, leaking bowels, and a lot of women post pregnancy, post menopause, once they deliver, have a leaky bladder, and most of them just wear a pad or diaper and go on with their life.
Yes.
Why is this and what is this? Why is it happening?
I think that it stems from a couple of things, right? So, one is that when a woman gives birth, right? And I hear this time and time again from my clients, during the pregnancy, a lot of attention is on them, a lot of love, a lot of care. Everyone wants to make sure that they're doing okay, baby's doing okay. And after the pregnancy, all the attention is on the child, right? The woman kind of gets left behind. And part of it is that she also doesn't prioritize herself, right? Very naturally, she starts prioritizing her child. So a lot of the gynecologists who I work with will say that the mother will come in for the child's checkups and vaccinations post delivery, but she'll not come for her own checkup.
Yeah.
Right? So they're like, we want to tell her to go for pelvic floor physio, or we want to make sure she doesn't have these symptoms, and if she does, to come and see you. But she doesn't come and see me in the first place. So I don't know how to even tell her this.
Okay.
Right? So that's something that they struggle with. Now, there's another group where they will go, the women will go to their gynecologist however long afterwards. It could be urologist, gynecologist, any physician, and they'll say, I'm struggling with this, right? And they'll tell them that's just part of postpartum. That's just how it is. I have
It's heartbreaking.
It's heartbreaking. It's so frustrating when I hear this. This week alone, I have a client who's 83 years old. She's like more of a high profile client, and she's being followed by a geriatric professional, right? Somebody who is an expert in geriatric health. And that person told her she's been dealing with chronic urinary tract infections and overactive bladder, which means she's constantly leaking urine throughout the night, like big leaks, keeping her from sleeping at night. And the geriatric physician told her that this is just old age. And I'm like, why? And she went to another center, St. John's, I don't know if you know, has opened up a
Yeah.
huge geriatric center, and they actually told her that go and see Dr. Anuja. Go and see her. And she's come to me now. It's been 2 weeks and she's doing better. We've set her up with a program and she's not leaking as much. The quantity that she's leaking is less. So automatically, just in 2 weeks, right? Actually, 1 week since I actually set her up with that with the TENS machine, she's doing so well, right? Imagine in 1 week her quality of life has improved. So it's frustrating because yes, like there's a combination of people not reporting their symptoms or addressing it because maybe they go and tell their family members and their family members are like, yeah, this happened to me also, it's just part of it, like
Yeah.
you just kind of have to deal. Or the medical provider is also telling them that, and they don't know what to do and where to find that solution. And thankfully now, with the world of technology and the internet, if you start Googling, you find answers,
Yeah.
right? And then you start looking, and that's how you get the help that you need.
No, that's really, really important with all the case studies that you put across, because I have seen health providers, to medical providers telling patients the minute you either start leaking urine, or the second problem you have is you see in men wherein you have stasis of urine, or the urine is not able to pass out of the bladder.
Yeah.
The only thing in geriatric patients they end up doing is catheterization.
Oh yeah. Oh my gosh. Or urethral dilation.
Yes. And it's heartbreaking because that just sets them up for a life of continuous infections.
Yes, right. Or I see this again very often. There's so much research now out there that shows that if you use a topical vaginal estrogen cream and perimenopause and menopause, it can significantly decrease the recurrence of urinary tract infections. Right? This is literally like a life-saving tube.
Yeah.
That does not cost a lot of money. It does not take a lot of effort, right? And hard to find people who are prescribing it.
Yes.
Right? So
very, very right.
yeah. So something as simple as this, right? And this is happening in the US also. It's a worldwide thing. Like now finally the American Urology Association has put out a lot of, data on this and guidelines on this, but there's still so much fear around using it. And so I think we just have to keep talking about it. And what I tell my clients too is that you talk about it. Tell your friends.
That's
Start that
important.
conversation, because if a friend tells you that, hey, I dealt with the same thing and this is the help that I got, you're more likely to believe it than if a doctor tells you.
Yes,
right?
100%.
So and that's the hard part about sexual health, is that it's still taboo. It's still hard to have those conversations. But I have some very brave clients who do talk about it and who are telling their friends like, hey, you should not be having pain with intercourse, right? And empowering them. So I think the more we have that discussion, and we have that discussion at a very young age, the better it is.
Yeah, I think that's very, very rightly said. Having that discussion at a young age is really important.
Yeah.
Dr. Anuja, just now we were talking about pelvic health at different age groups, right? And we were talking about how this should be a conversation that happens at a young age. Can you tell me what actually happens in our pelvic health or to our pelvic health from 20s to the 80s?
Sure. I'll actually start even younger, because there are changes that are happening in our pelvic health from when we first get our period, right? And that's around at age between 9 to 16, you can say. So that's like the first change that you have in your health in general and your hormones, right? Because when you start your period, you start having a change in the hormones that are coming into your body. You have body changes, right? And of course, right, that's when you kind of discover that you have a vagina, right? Before that, you don't really think, because you're like, where is this blood coming from, right? And I can say, even from personal experience, that like, yes, my mom sat me down and she kind of like, she told me this is your period, etc. But I didn't really realize that we have 3 holes down there, and that the period blood is coming from this particular hole, right? So I think that it's really important that we start educating our girls, daughters, nieces, etc., about just the general anatomy that you have, because there's just already so much shame around that in general. Like, don't touch down there, don't wash down there, don't any of those things. And so making them understand that it's not a bad thing, right? Our vulvas are not bad things. Our pelvis is not a bad thing. So it's actually amazing that we get to have a period and we get to have it on time, and it that means that our body is functioning the way that
Right.
it should, right? Getting your period is not a bad thing. It's not a shameful thing. And even discussing the use, it doesn't have to be right away, but even just discussing the use of tampons, menstrual cups, right?
Yeah.
Things that can make life easier. I remember that for me, like again, it was back in the 90s, early 2000s. So the use of tampons, we didn't really talk about, right? And so I stopped swimming because of that. I was going
Yeah.
for swimming once a week. And because of these changes in my body, and I was feeling uncomfortable, and I didn't really have like a way of processing that information. So a lot of girls actually stop playing sports when they get their period.
Yeah.
And it's so disappointing, right? Because now we're talking about strength training and we're getting strong, etc. But if we don't start that at a young age, it becomes much harder to start it. It's not that you can't start it at an older age. It's just that it's another hill to climb.
Yeah.
Right? Our bodies are not used to it, and so we have to push harder to get into that mindset of
Yeah.
getting stronger and being more active. And so even recently, I have a niece who started, and if I started talking to her about like, okay, like what are your thoughts on like trying tampons? And of course, you don't have to try it right away. And she's like, no, it hurts, like it hurts
Yeah.
when you put a tampon in. And I had not talked to her about this, right? I don't even think her parent had talked to her about this, but imagine that's the first thing that comes into mind. So, of course, her nervous system, when she tries to insert a tampon, is going to react to that if she's
Yes.
expecting pain. And so I did some education. I'm like, no, it actually doesn't have to hurt. It can be a very seamless process.
Yeah.
So starting those conversations, right? And then again, there's so much fear around using tampons and menstrual cups. And so there's
Yes.
just
Very
barriers that we have
rightly
to break.
said. Because I do keep talking to younger kids about using a menstrual cup or a tampon because it's just so much easier, right? But I mean, why do we have to go through wearing a pad and then it's just not a comfortable thing, right? Already, like you're in pain and your hormones are everywhere, but there's just so much fear. I wouldn't say taboo, but fear about inserting something into their vaginas.
Correct. Yeah.
Number one is they're also confused which hole does it go in.
Yeah.
And number two is what if it just goes all the way up?
Yes, what if it travels?
Yes.
That's another very, very common fear that people have, 100%. So, I also think that it's important for us to kind of address that. For some people, it might be more comfortable for them to wear period panties and for them to wear pads. And I think that's totally fine.
Yeah.
It's up to you, right? The decision is yours. You should have options. That's what I keep telling my clients is like, whatever you choose to do, you decide. Like, I have no problem what you decide to do, but I just want you to know that there is another world out there where you have the option, right? You
Yeah.
want to go to the beach, you shouldn't be limited because you're on your period, right?
Yes.
Like, we can't plan our holidays around when our period is coming.
Yes.
So it's those types of things. Or if you want to, if again, it might feel more comfortable when you're exercising, right? You should have that option for you. Now, in terms of addressing that, like, oh, what if it travels? Can it travel, right? One thing that I will often say is that, use my model to kind of show, is the vaginal canal is made of muscle.
Yes.
Okay, so it can stretch.
Yeah.
It can stretch quite a bit, especially when it comes to sexual intercourse, right? But even when we want to insert a tampon or a menstrual cup, it has the ability to stretch, and our pelvic floor muscles are surrounding the vagina, right? And so again, we have to focus on not just the vaginal canal stretching out, but the muscles also have to be able to relax. The gates have to open up in order for anything to go in or come out. So we have to teach people how to do this very often. It doesn't come for some people it comes naturally, right? You kind of breathe and you open up and you relax, but for some people it doesn't come naturally. So that's an important aspect too of being able to teach somebody this. So I have clients who come in who are not necessarily interested in sexual intercourse at the moment, but they really want to insert a menstrual cup, right? Or a tampon. And we work on doing just that.
Yeah.
right? It's not about the intercourse component. It's doing just that. And it's so rewarding. They bring in their tampons or menstrual cups, and we actually practice it together. And I have them get into position or do certain stretches, and they're able to insert it, right? And then they're like, they feel so empowered. They're like, oh,
Yeah.
okay, it's possible. So yeah, I think and going back to the discussion of like, what if it travels, right? So again, the vagina has a suction system, which is why sometimes it feels like even when you're pulling out the tampon, it can, or the menstrual cup, it can feel like a little uncomfortable because that suction has to break, right? So the chances of it traveling up are very, very, very low, especially because it can't go right that high. So yeah, that's another myth that I want to kind of bust.
And another thing is, can we now go on to the next phase of life, that
Sure.
is pregnancy?
Yep.
Can you tell me what's actually happening in pregnancy? Because yes, we've gone a little ahead in getting people to do pregnancy yoga, but is that enough?
Yeah, that's a very good question. So, um, with pregnancy, right, we have a ton of changes in the body. Our hormones are doing all kinds of crazy things. That would be like a podcast, a complete separate podcast, right? But what's important is that when these changes are happening, our muscles really need to support us, right? Our muscles and our ligaments really need to support us. And it's a very, again, common misconception that the laxity of your ligaments are the reason why you're having so many problems. Because your relaxin hormone actually does not, by first trimester, the amount that it's releasing is actually very low. Second and most of third trimester, it's low. Towards the end of third trimester, again, it increases. So the pain that you're experiencing is not really about ligament laxity. It's likely because your muscles are not supporting you in the way that they should. Your muscles are like an orchestra, right? They all work together, and sometimes one is supposed to do a little bit more work or be a little bit louder, and the other is supposed to quieten down, and vice versa. And when you get pregnant, that orchestra kind of goes into a disarray, right? It doesn't know what it's supposed to be doing when. And when we do yoga, of course, it's helpful, but we also have to strength train during pregnancy. I just do not see enough women strength training during pregnancy, because there's just so much fear around it. Yeah. I think fear around exercise in general now is getting, I think in the last 1 year, I'm seeing clients who are at least less scared than they were when I started 3 years ago. But even then, like, there is still a lot of fear of, oh, I've just been told to do walking or yoga or stretching. And even the yoga that they're doing, see, yoga can be a form of strength training, right? There are a lot of asanas that help you get strong, but the yoga that they're doing during prenatal yoga is really just stretching. Yeah. And that's important. Mobility is important, but you have to strengthen the muscles.
Yes. Literally, you wouldn't believe the 3 exercises that most pregnant women do today. One is a duck walk.
Yeah.
The other is a squat. And the third thing is they just stretch their adductor muscles by, going into a V stretch.
Yeah.
What is your take on that? Is that enough?
No, I don't think. I mean, see, again, with the duck walking, first of all, is pretty hard. It's not an easy thing to do. And usually we recommend that you start doing that towards the very end of your pregnancy to help you with the baby, right? But no, I don't think it's enough. I think you have to work on breathing, coordinating your muscles, and honestly speaking, you need to start this when you're trying to get pregnant or even before that.
I think that's important because
yeah.
After you're pregnant, starting it may not be the right thing, but this is the conversation they need to start having before they're pregnant. I think that's very important.
I think that when you go to see your gynecologist, and a lot of women, first of all, don't go see the gynecologist until they're going to get pregnant, right? Like we see in the Western world. I remember that I was told in health class in high school that, like, you have to start going to see your gynecologist as soon as you become sexually active, or even before that, right? Or at least by the age of 25, you have to have a pap smear, right? Because of cervical cancer, which is so important. So firstly, like, most women are not doing that, right? They're not going for a regular gynac checkup until they feel like they want to start getting pregnant, and then that's when they come in. Now, when that happens, the gynecologist usually runs them through like a bunch of tests that they should do, right? And in my opinion, at that time, there should be a conversation about, are you exercising? If not, this is what you should be doing. And if you are, again, this is what you should be doing, right?
Yeah.
To prep your body. Or sometimes you're over exercising, and that can also be harmful when it comes to trying to get pregnant. Now, when you do get pregnant, and let's say you're somebody who has never been active before, right? Never really done any kind of, whether that's yoga, strength training, anything. The general rule of thumb is don't start anything new, right?
Yes.
Now, I'm not against that rule of thumb, but actually what I think it needs to come with like an asterisk, right? Don't start anything new without guidance,
Yeah. I think that's
right?
incredibly important.
So if you've never done it before, it's okay. I always tell my clients, like, it's fine. Don't get scared. Don't think that, oh my God, because I didn't do strength training earlier, now I have to wait until after I'm pregnant to start strength training. No, but do it with guidance. Do it with somebody who understands what pregnancy is like, who understands what the changes that you're going through are like, what types of exercise you need to be doing, and what you should be focusing on. And that could be from a pelvic health physiotherapist, but it could also be from a personal trainer or a strength and conditioning coach who has done some education around this, right?
Yeah.
That's another very important thing. I see too many people out there calling themselves women's health expert, or, pregnancy, postpartum coaches with like one random certification here or there. Like, you need to work with somebody who really has a good understanding of what's going on and has gotten education from a proper certified place.
Yeah, I think that's incredibly important because that's what we're forgetting in this entire process of, just trying to get pregnant, have a baby, and just trying to do so many things. I think number one should be go to a person who has enough guidance to give you rather than just telling you that this can be possible or this cannot be possible.
Yes, exactly. And, even during pregnancy, there are a lot of people who say, like, you can't do planks and you shouldn't do this. I see, like, this irks me like none other. I see these Instagram influencers who have like hundreds and thousands of followers, and they're like, oh, during your pregnancy, don't do this instead. Or during a postpartum, don't do this, and I'm like, no, no, no. Like, this is a one size fits all model that you're just posting on Instagram.
Yeah.
Like, there is no hard and fast rule that just because you're in your third trimester you cannot do a certain exercise.
Yeah.
It just depends on where your body is at and what's going on with your body, right?
Yeah.
So
I mean, 100%.
I think that's really important. And the other thing that's important is that, again, this goes back to, oh, this is part of my pregnancy, so I have to just deal with it, right? Low back pain is just part of my pregnancy, so I have to deal with it. And that's not true. You don't have to suffer through this pain, right? I have an amazing gynecologist who I work with, and she sent me a patient a couple of weeks ago, and she was like, I told her, like, why is she suffering? There is an option for you, right? You have the option of going and working with a pelvic floor physiotherapist, and now that client is just feeling so much more comfortable as she's
Yeah.
moving into her third trimester.
And another common thing is a lot of women go through tailbone pain.
Yes.
And
Yes.
most gynecologists tell them that it's your third trimester, it's normal, and this is what you're going to be experiencing. Why is that actually curable?
Yes, 100%, right? So a lot of pain is very common in pregnancy because, again, there are nervous system changes that are happening, and your body is not, the nervous system is not able to support you in the way that it should.
Yeah.
It needs a little bit of retraining, it needs a little bit of nourishment. But just because it's common does not mean that it's normal.
Yeah.
Right? You do not have to suffer through this pain at all. And, just to kind of show you, your pelvic floor muscles end at your tailbone. So
Yeah.
again, people ask me, oh, is pelvic health related to, coccyx pain, tailbone pain? I'm like, yes, 100%, because your muscles are all attaching back here,
Yeah.
right? So if you've got pain here, obviously there's going to be something going on with the muscles. It's just very natural.
Yeah.
And so there's 100% so much we can do to address it and release that discomfort.
Yeah.
Because the sooner you release the discomfort, the sooner you address the pain, the less likely you are to experience it later on.
Yes.
Right?
And I think that's very important because most women go through it thinking it's normal.
Yeah.
And the suffering doesn't end here. Postpartum, I know a lot of women who have a prolapse of the uterus, and sometimes the uterus is just coming out of their vaginas. Why is it happening? And the easiest thing that most doctors, at least 5 years ago, told was nothing now, we just have to remove the uterus. Nothing, there are no muscles to support it. So that's the way to go about it.
So when it comes to prolapse, right, it's not just your uterus that can prolapse. We call it pelvic organ prolapse. So it could be your bladder that's prolapsing, it could be your rectum that's prolapsing, and of course, it could be your uterus that's prolapsing, right? Now, the reason why this generally happens postpartum, or as we age through menopause, is because think about it. You've had a baby that's sitting inside the pelvis for 9 months, right? Or however long. And so the muscles in your pelvic floor just from the weight of the baby, right, will lengthen. That's it. It's just that. And when the muscles are in an extremely lengthened state, especially in a very short period of time, this is happening very quickly, right, in the body. So it's not just, of course, these muscles, it's also your core muscles that are completely expanding, right? They're not able to support you. So there's a huge change in your intra-abdominal pressure and how your body's managing that pressure, right? Now you have the muscles are a very relaxed, lengthened state. And if we're not working on getting all the other muscles, including the pelvic floor muscles, strong during our pregnancy, right, in postpartum, after there's trauma to the area, whether you've had a vaginal delivery or a C-section, right, doesn't really matter, you're going to have weakness.
Yeah.
Right? So that's one thing. Now, the second thing is, how did you push your baby out, right? If you had support and if you had nice control and you had awareness of your pelvic floor muscles and understanding of how to push the baby out, right, you are less likely to experience pelvic organ prolapse, because we have this very common thing that happens, especially when we're constipated, right? We try to bear down and push. But what that does is that really increases the intra-abdominal pressure. And again, it's too much pressure down through the pelvic floor. And that can also cause a prolapse. So if you're doing that bearing down, or what they call purple pushing, during your delivery time, right, again, that can increase the chances of you experiencing a pelvic organ prolapse.
Yeah, I think that's very important to know it. If there are some tips you want to give the viewers about how to take care of their pelvic health, what would that be?
So I think number one is breath work is very important, right? Your pelvic floor is so crucial in helping with your breathing. And again, it helps you with your nervous system, which is always good for your pelvic health. So I think that it's really important for you to understand how to breathe correctly and how to relax the pelvic floor muscles the way that you want them to, or contract if you need them to, right? You should basically have that mind-body connection and be able to control your pelvic floor muscles, just like you can control your bicep. It's the same thing, right? It's part of your body. It's just that we don't get to see those muscles.
Yes.
The second thing is that I always tell people, focus on your gut health, okay? Because constipation or chronic diarrhea or IBS can really mess up your pelvic floor, okay? So it's so important that you focus on what's going on with your gut to make sure that you have good, beautiful stools as often as possible and as regularly as possible.
Right.
And the third thing that I would say is that make sure that you're mobilizing and you're strengthening. So that is your full body in general, right?
Yeah.
Mobility is just as important as strength. Proper mobility, moving the pelvis, making sure that we're spending time really relaxing the muscles in our body, not just your quick 5-minute stretch that you're doing at the gym, like good joint mobility, along with strength training and making those muscles strong so they can support you, is going to be very important.
I think that's a great takeaway, because that's something, a small place where anybody who has pelvic health issues can actually start off. But if there's something that you just want to scream from the top of your voice and say that stop doing this, what would that be?
Stop doing Kegels. Please. If somebody tells you to do Kegels, just look up where is the closest pelvic health physiotherapist and go see them. Don't waste your time doing Kegels. Just go
Right.
see a pelvic floor physiotherapist.
So, Dr. Anuja, now you have a lot of people who do not know when they should come and meet a pelvic health specialist. Can you tell me what are the problems and what are that, like a pelvic health screen, if we were supposed to say?
Yeah. So I'll just kind of take you through a general pelvic health screen that I usually talk to people about if they feel like they don't know why they should come to a pelvic health physio, right? First is if we go through the bladder. So, number one, if you have any kind of urine leaking. Now, that urine leaking could be from laughing, coughing, jumping, lifting something heavy. That's what we call stress urinary incontinence. But there's also urge urinary incontinence, which is where you get the urge to urinate, and the time between you getting that urge and going to the washroom, whether that's a 2-minute period of time or a 1 hour period of time, you start leaking urine. So that's again not normal. You want to be able to hold it for a good amount of time in case you're out somewhere, etc. If you feel like you're urinating very frequently, so normal urination time is every 2 to 4 hours, and that's even if you're drinking 2-3 liters of water a day. So if you feel that you're going very often and that's taking over your life, like you're planning on whenever you're going out somewhere, you're thinking where is the next washroom, or where will it be in the mall when I'm walking around, that's concerning. That's not normal, and that's something that we can address. If you feel like you're not able to empty your bladder completely, like you're sitting on the toilet but you're not feeling satisfied with how much urine has come out, or you feel like, oh, it's something is still left, that's again something that has to do with your pelvic floor, and we can address it.
Right.
So from a bladder perspective, of course, if you're experiencing any kind of pain, burning, discomfort with urination, if you're having a hard time even just starting the stream of urination, that's something that we can address from a pelvic floor perspective. When it comes to your sexual health, of course, if you're experiencing any kind of pain, burning, discomfort with penetrative intercourse or even oral intercourse or even clitoral stimulation, that's not normal, come and see a pelvic floor physiotherapist. If you're experiencing significant period pain that is really bothersome to you, go and see a pelvic floor physiotherapist.
I think these are really important, especially everything that you listed out, because I know each of these problems somebody in my family has gone through and nobody was able to help them.
Yeah.
Like literally nobody.
And we've not even gotten to the bowels, right? So imagine there's just so much out there that we can address from a pelvic floor perspective. Of course, if you have any kind of significant chronic constipation, because at the end of the journey of your stool, your poop has to come out, and that's happening with the pelvic floor relaxing. So if that's not happening, then again, that's concerning. If you're spending hours and hours on the toilet and nothing is coming out, or if you're noticing that you're smearing stool, that there's stool in your underwear even after you go, that's again something that a pelvic floor physiotherapist can help with. If you have anal fissures, hemorrhoids, also known as piles, again, make sure to go visit a pelvic floor physiotherapist. And then, of course, if you're experiencing any kind of tailbone pain, pelvic pain, abdominal pain, make sure to go see a pelvic floor physiotherapist.
So actually, Dr. Anuja, I think we'll never be able to end our conversation because I know that each of these things, right? Bowel physio, then we have the bladder, then we have the sexual health, then we have the general pelvic health physio. I think each of them are like separate podcast topics. And it's really hard to kind of cover all of them at one go, because I am more and more excited to talk about all of these things, because I know for a fact that when it comes to abdominal health, people are suffering silently from IBS, from piles, rectal fissures, hemorrhoids. And there are a lot of people just going viral and telling you that if you eat a lot of protein and a lot of meat, this is why you're having these things. And I see them in my practice. But I hope we go to a place where people are actually discussing issues for what they are and not for the views of it. And we are able to help more people. more people are able to be pain free, because this is a life we have that we can be pain free.
Yes, yes, it is definitely possible to be pain free. And it goes back to our very beginning of our conversation about quality of life and health
Yes.
span, right? If we, don't enjoy our lives, and if we don't have a good quality of life, what's the point of living?
Yeah, yeah. I think it's been a wonderful conversation about pelvic health and about where we're going with our pelvic health. And also, very important that we were able to address sexual health concerns. We were able to address concerns throughout, from puberty to menopause to pregnancy, right? I think it's a wonderful time today that we're able to have these conversations, because earlier these were just taboo. They were just hush hush. I think that's a great end note to the show, because it's been great conversing with you. And honestly, I would want to get back to you and like talk about each of these things in detail. Hopefully, someday you have the
Yes.
time for it.
Yeah.
And thank you so much, Anuja, for actually giving us your insights on what pelvic health should be. And I think now more and more people can actually reach out as a way of general practice, to reach out to their pelvic health specialist, to reach out to their gynecologist, even though they don't have a problem.
Yeah. Thanks so much for having me.
Thank you so much.